Speaker.
The Honourable Member for North Island Powell River.
Thank you, Madam Speaker, and I'm incredibly pleased to be here today to speak on Bill C-237, an act to establish a national framework for diabetes. It is an incredibly important private member's bill because it addresses some things that really concern me. The reality that people with diabetes across Canada are being treated very differently depending on what province or what territory that they are in. I want to thank the member for bringing this forward. I want to thank her for her passion on this very important issue, and I'm so happy to be here to discuss why it is so important. Madam Speaker, a couple of years ago, the juvenile diabetes folks came to have a conversation with me. I met with two teenagers. One was from Alberta and one was from British Columbia. Now, I know that as members in the House, we all have those moments where we hear stories and we just think to ourselves, this is wrong. We have to do something to make it better. That day, I learned that there are people living with diabetes that can have something inserted into their arm that allows them to scan it with their phone really quickly to check their blood sugar levels. No more pricking of fingers, no more carrying around those tools. They can quickly scan, see how things are going, and address it as they need to. The problem is, in one province, there is a monthly fee for one of the teens, and in the other province, there was no fee at all. It really broke my heart when I had to hear from the mother of the one teen who was in the province where a monthly fee was required, and how they were doing really well paying that monthly fee, but her husband got hurt on the job. And because he got hurt on the job, he was now off and their income had gone down significantly. The mother told me one of the hardest choices that they had to make was to acknowledge that they could no longer afford the monthly fee. And that meant that their child, their daughter, had to have the pump removed and move forward. No parent wants to ever do that. Madam Speaker, it completely broke my heart. I don't think there's any parent in this country that would be happy to be in that type of situation where you have to make a decision on the health and well-being of your child or actually feeding them at home. I recognize that across Canada, there are so many parents who have children who have health issues and they really struggle or cannot afford the basic medication that they need to make sure their child is well cared for. And this is one example. We need a better strategy. I think it is important here, Madam Speaker, to point out that a national pharmacare program would address this issue, ensure that parents are not making choices like this parent was between their child's health and well-being and feeding their child or keeping a roof over the head of their child. The facts are very clear. Individuals with diabetes cannot regulate their blood sugar properly. Diabetes causes many physical health issues, and it is the cause of death for more than 7,000 Canadians every year. Diabetes also impacts the mental health of people who have diabetes as well as their families. I think it's time for Canada to take this seriously, and I think this bill is one step towards doing so. Really what this bill does is ask the government to bring together all provinces, territories, Indigenous leaders, and stakeholder groups to create a plan to support those living with diabetes more holistically. Madam Speaker, diabetes is a chronic disease, and it is so important that the federal government do more to support Canadians living with diabetes, particularly those who incur significant out-of-pocket costs because of this. Too many Canadians living with diabetes are unable to afford the medications, devices, and supplies that they need. When people cannot afford their medication and supplies, the reality is this leads to bigger health issues that can lead to an early death, and that is just not acceptable in a country as wealthy as ours. Families and loved ones feel this reality, and it's really scary to always be worrying about what they will do if they can't afford what that person needs. Not too long ago, I received a message from a constituent who had just been diagnosed with diabetes and was really scared. She was not sure how she would afford the medication. When dealing with a chronic illness, the last thing the body needs is the stress of wondering, can I afford the most basic of the supplies and medication that I need? And we know this is true. A recent report from the Canadian Federation of Nurses Unions found that 57% of Canadians with diabetes reported failing to adhere to their prescribed therapies due to affordability issues related to their medications, devices, and supplies. 57%. Madam Speaker, that is more than half of the people who have this chronic disease. This is important because research has been done, and when a chronic illness is managed, the expense is lower and the health of the individual increases. Preventative supports matter. It allows people to care for themselves and prevents repetitive visits to the emergency room caused because of a lack of access to medications, devices, and supplies. And again, we have to think about what this means in Canada, one of the most wealthiest countries in the world, and these realities are because people can't afford their medication. This is why Canada's New Democrats recognize there is an urgent need for universal, comprehensive, and public pharmacare, a plan to ensure that all Canadians have access to the medications they need when they need them, that we don't have people like my constituents staying up half the night wondering, how am I going to afford this new expense in my life? This must include coverage for diabetes devices and supplies such as the test strips, syringes, insulin pumps, and continuous glucose monitors. Sadly, we've seen the reality that the Liberals and the Conservative governments, one after another, continue to deny this measure that would create more affordable and a fair system to care for the well-being of people across Canada. It would save significant money across this country by lessening emergency healthcare costs and that are extremely high and terrible for the health of people who cannot afford their medication. Universal health care would also support businesses who have multiple challenges when they have a team member who has a health issue or loved one who has health issues that in some cases, even with health insurance, cannot afford the cost of their medication. But here we are, just weeks ago seeing this government make promises, but when they actually have an opportunity to support pharmacare, they say no. How many times do Canadians have to wait and ask again for this human rights-based approach? Madam Speaker, I will be supporting this bill. I think it is a step that will at least support people living with diabetes. I hope that the government will support this. And when the bill is in place, I certainly hope we finally see the concerning reality that so many families who are applying for the disability tax credit when they have children who are born with diabetes lose it when that child comes into adulthood. The government of Canada is rejecting these applicants in the past, and I hope that that stops. Denying this most small tax credit, and most importantly, making sure that they have access to the RRSP they invested in for many years, is absolutely key for me. There is a lot of injustice for people living with chronic illness in this country. I hope this bill will at least help one portion of the community. But I want to remind everyone in this House that only pharmacare will make it a more fair system for everyone in this country. Thank you, Madam Speaker.